The state is warning parents about an outbreak of pertussis, better known as whooping cough. The Oakland County Health Division has reported an increase in the number of cases recently. Pertussis is highly contagious and can kill infants. It starts with a mild fever and a dry cough, along with cold symptoms, including a runny nose, congestion, sneezing, and watery eyes. The severe coughing starts after a week or two. It leaves patients with no air in their lungs and a whooping sound as they inhale. It's important for parents to know that some infants may not actually cough at all. They'll just stop breathing and turn blue. That's why doctors say pregnant women and anybody who is going to be around a newborn should get a Tdap booster.
The booster actually passes the immunity to the baby because the babies do not typically start their pertussis vaccines till about 3 months. So there's a window of time between 0 and 3 months where the baby is susceptible to whooping cough.
The CDC recommends women get a booster for each pregnancy. The vaccine is not 100% effective. Doctors recommend children get the vaccine at 2, 4, 6, and 15 months. The final dose comes at 4 years old. The state Vaccines for Children program helps families who cannot afford the shots, so you should check with your county health department to see if you're eligible.